Welcome to Unity with Pam, with your host, Pam Willis-Hovey.
Good morning, everybody. Welcome to Unity with Pam TV Show Healthcare Luncheon. We are here on location at Valley Healthcare Systems. Thank you so much for all of you coming, all your smiling faces. It's an honor. Every time we see people come, every time we do a show, it's just wonderful to see people come out and support the work of the Lord, the will of the Father, and also the will of the community that the Lord is doing through each and every one of you, because you are definitely changing faces and you're always changing a life. With that being said, I'm going to go ahead and call for the invocation. Ms. Rhonda Miller.
Please go before the Lord in prayer with me. God, in the name of Jesus, we thank you so much for this opportunity. We thank you so much for your precious Son, Jesus Christ, who died and was raised up so that we could have eternal life. We thank you for Pam Hovey, God, for the ministry, for the networking, for her heart that goes out to the community. We thank you for Valley Healthcare for allowing us to be here today and for the wonderful work that they do. We lift up this meeting before you. We invite your presence and your direction and your insight, your wisdom, and your love into this place. In Jesus' name, amen.
Sarah Lane, take it away.
All right. Well, thank you. Thank you. I welcome each and every one of you to our new facility. It has been quite a journey for us. We started out in Baker Village, on the other side of Baker Village, on Benning Drive. And we worked with the Housing Authority to establish our first unit, our first satellite here in Columbus. And it was quite an adventure for me when I moved here from Michigan, and I came down and I said, oh goodness, where are we going to set up? But there was a need here in South Columbus, even though our heart and our mission was for all of Columbus and all of Muskogee County. Our heart was here in South Columbus, or as the previous mayor, Columbus South, whichever you want to call it. But our heart was here, and we wanted to establish our first center here in South Columbus. But also, when we started our plans to expand and to establish our new facility, our heart was still here. Others were trying to convince me that we should move to North Columbus, East Columbus, even outside of Columbus. But our heart, myself and the board of directors said no. We started in South Columbus, and we want to support South Columbus. We want to be a part, if not a key role, in the revitalization of South Columbus. So here we are on the hill, here to support all of Columbus and all of Muskogee County. And again, if we can help you in any way, please make sure that you contact me and our staff. We're here to help. I want to make a political statement. We have been very heavily, I guess, part of the budget cuts that were announced last week. And I want to give you an example of the immediate impact of such budget cuts. I had a patient to call me. We had to ask her to come back a different day because we were impacted so heavily. We had to have some of our staff were out, and of course we couldn't bring in additional staff to support the need that day. And she called me back and says, "You're here to help us." And I want to call her back and say, yes, we're here to help you. But please call your congressman. Because that's where the impact, that's where the decisions are being made for us. We do receive a small grant from the Department of Health and Human Services that helps us to provide the expanded care. But that's been cut. Medicare reimbursement has been cut immediately. So I need for you all to make those statements and to make those calls to our congressmen, our senators, to tell them how their decisions are impacting us at this level. So again, I want to say thank you for coming to our home. And again, make sure that you get some of that fabulous food back there. I'm observing Lent, so it is so it's really taken a lot of my faith not to go back there. but please enjoy yourself, and in designated places we will have you to tour our new facility. This is a 30,000 square foot facility. Dental health, medical health, women's health, pediatrics. We have behavioral health as well. And we have a little known service called telemedicine. So we can also help you stay right here in the community, but also have a real-time visit with specialists in other places within the state or the nation, for that matter. That's how this technology is moving ahead far faster than I am. Too close to retirement is getting too much for me. But again, all of our services are here for the community and for you. So just let me know how we can help you, and thank you again.
Unity with Pam is being brought to you by these great sponsors.
When you've been hurt in an accident, it helps to have experienced and knowledgeable attorneys to help you in your time of need. For over 30 years, our office has been helping victims in auto and truck accidents or with work-related injuries. We resolve thousands of cases both in and out of court. So if you've been hurt and it wasn't your fault,
talk to Walt.
Talk to Walt. Talk to Walt.
Talk to Walt.
For your free consultation, call today, 1-855-GO-ASK-WALT.
For more than 60 years, the Dairy Queen recipe for success has been simple. It's been a combination of hardworking people, great tasting food, and tempting treats served in our establishments every day. Although a lot has changed in 60 years, some things remain the same. The smiles on children's faces, a treat for a good report card, close friends enjoying a great meal, and families spending quality time together. Here at DQ, we are always committed to treat you right.
When Bill Larson's brakes started squeaking, when Pam Summers' check engine light went on, and before Tom headed out on vacation, they all came here. Midas. Total car care. Total customer care. That's the Midas touch.
Welcome you to be a part of our ministry. This is not a put on, but this is a come on. And we come to share in our different ministries with our dance team, with our choir, and our TV ministry. And we're looking for great things to happen, great miracles to happen within this great thing to happen, great miracles to happen within this place. Come and be a part of the blessing plan.
Hello. Some people wonder, why does one need a diabetes educator? Well, if any of you have diabetes and you went to your doctor's office and he told you that you had diabetes and he said, take these pills, don't eat anything white, no desserts, and that's all you get. Well, it takes a lot more than that to manage diabetes. And with the severe complications that occurs from unmanaged diabetes, the amputations, going blind, kidney disease, education about diabetes is a must. So if any of you happen to have diabetes and you've never seen a diabetes educator, then tell your doctor you want to see one. You want to know more about your disease so that you can properly take care of yourself. Diabetes is a manageable disease while there is no cure. And of course, you are the manager and the owner of that disease, whether you ask for it or not. So that's what I do here. We try to get as many of our patients with diabetes to come in so that we can teach them how to manage and how to take care of themselves. Some people have diabetes, and if they don't think about it, they think that it's going to go away. That's not how it is. Diabetes is a disease that will cripple. I've had a doctor to say, well, diabetes won't kill you. But then he smiled and said, it'll make you wish you were dead. So managing your diabetes is most important, and we are here for you.
Next from our staff is, I guess I would call him my right hand, left hand, and anything in between that I can get him to do for me. But Marcus Green is LPN, and he is our risk manager, and he's our community outreach, and he's on the floor, and I tried to explain this to someone yesterday. He's just one of the pillars here at Valley Healthcare System, and I will have Marcus to come and speak with you.
Good morning. I wasn't aware that I was going to be on this program. I would have shaved a little closer so I can be a little prettier, but here I am. What I want to do is talk about one of the most exciting things that I feel like we're going through at this point, and that is we're trying to become recognized as a patient-centered medical home through the National Committee of Quality Assurance. And what that is that they've taken 6 elements, and they said that these 6 elements, if you do these things well, then you should have better outcome for your patients. All right? And one of the first things they talk about is enhanced access and continuity. Basically, they're saying that our patients will have an opportunity to come and see us when they need to come and see us. All right? So we do little things like we have dedicated slots for people to walk in, because you might wake up that morning, you're sick, and you need to come in. So it's not one of those things where you're not scheduled so you can't get here. All right? The other thing is we manage patient population. Okay, what that is that we take some risk measures there, and we look at it and we say these people tend to get less care, which means they have less outcomes, or good outcomes from the fact that they don't get this care. So we have a group of people that we look at, and we run a lot of data on, and we did a lot of reports to see where they are, and we continue to look at those things to see what we can do differently to increase their outcomes. Okay. The third thing is to plan and to manage care. Now, this is those group of people. One of them is those diabetes that Ms. Culpepper spoke about earlier. And what we do is we take those group of people, we run a registry, and we look at all the little things that they say that you need to do to make sure that these people have good outcomes. And when those patients, let's say we're going to do hemoglobin A1Cs every 3 months. If they're not here in those 3 months, then we got somebody on the telephone calling them, and we're trying to get them in, because we understand that that is a critical measure in their care. We also provide self-management. Again, Ms. Culpepper talked about that. You are the manager of your health. All right, we can come up with the diagnosis. We can sometimes come up with the medication, but even then, it's up to that individual. You know, but we do a little bit different here. We don't just say, okay, well, it's your game and you should do it. We are very intimately involved in our patient care, and we try to do a lot more teaching to them so that they can do better with their care. Another measure that we look at is track and coordinate. Many times, patients get sent out to other agencies. Other agencies, and But we look at it that we are the keeper of the records, and we try to make sure that we get all that data back so that, again, we can teach them. Okay? So that's basically what we're doing right now. I would love to talk more to you about it. Hey, I'm here every day. If you have any questions, get with me.
From St. Francis Hospital, Ms. Gwen Johnson. She's the Administrative Director of Revenue. And we have some bios out there I want to pass out. But you're talking about a dynamic lady who comes all the way from Memphis, who's been over several hospitals in Memphis. Her husband, Mr. Monk Johnson, is here. He is an NFL alumni. And I'm very excited to have both of them here. I'm glad to have her back in the city. Her mother is here, her brother, sister, and we thank God for them being with us. With that being said, Ms. Gwen Johnson of St. Francis.
All right. So we've got just a few minutes here to talk a little bit about health care coverage. Thank you very much, Pam, for that introduction. And I also want to thank my family for supporting me. I have a brother-in-law who's here as well. So they have supported me from afar. Now they're near supporting me, but thank you very much. So y'all see how well I can be ambidextrous to manage this microphone and this clicker. So talk a little bit about St. Francis's services, Charity Care, EMTALA, that's the Emergency Medical Treatment and Active Labor Act, healthcare insurance terminologies, and then end up with healthcare reform. That's a lot, and we're going to cover it in about 7 minutes. All right. So St. Francis, you guys are very familiar with St. Francis. We offer a lot of services, inpatient, outpatient, emergency room services. We have services at the Bradley Center, mental health programs, the St. Francis Orthopedic Institute, Open Heart Center at the Patrick Institute, and of course you guys are probably looking at our commercial to where Dr. McRae and some of the team in the surgical suite are busting a move with the robot. Yeah. So our expansion, you may have noticed the expansion that we're working on, and we're looking at moving into 300,000 square feet. With that expansion, it will be an all-private room facility. We'll have a dedicated cardiovascular surgical suite, expanded emergency room, operating room, orthopedic institute, and we'll have a conference center with lecture hall and a 325-seat auditorium. So just look forward to that. As a matter of fact, our labor and delivery will open on Labor Day. So we are defined by our mission. We're a community-owned Catholic health healing ministry providing exceptional care in partnership with the physicians. All of the staff are governed by these core values: excellence, courage, professionalism, mutual respect. Now, one of our 10 strategic initiatives is community mission and outreach. And what we do with that is provide education as well as health screenings. One of the other provisions of our ministry is we provided $13 million in charity care for patients in the Columbus area. And a lot of people don't realize that and think most of the charity care is provided by Columbus Regional, but we do our fair share. And a large portion of that comes from Trinity Center for Women, which is located on Warm Springs Road. And at Trinity, we provide prenatal care for women who do not have the ability to pay, as well as those that do have the ability to pay. Okay, just one charity care. We talked about that $13 million number. So just want you to know that charity care, that's services that provided, healthcare services provided to patients that do not have the ability to pay. We're not talking about the people who refuse to pay and don't want to pay their bill. We're talking about people who don't have the ability to pay. And in order to qualify for charity care, it's based on the federal poverty guidelines and charity criteria. And those federal poverty guidelines are based on income, household income, number of people in the household. So as it relates to charity care, there's sometimes some emergent care that comes with that. And all hospitals, facilities that participate in the Medicare and Medicaid programs have to follow and be governed by EMTALA, which is the Emergency Treatment and Active Labor Act. So that has to do with the emergency room. That is the exact statute, those numbers that are there. But if an individual presents at the emergency room, if you look there, it says an appropriate medical screening examination must be done to determine if it is an emergency. So just because you show up at the emergency room doesn't mean that your case is emergency. So if it exists, the hospital is obligated by the statute to either treat the patient or transfer them after they become stable. If the patient does not have an emergency, then the medical condition, according to the statute, can be non-imposed by the hospital, which means that the hospital really doesn't have to treat that patient if it is not an emergency. Once the screening exam is done and it's determined that the patient is stable. As Ms. Lang talked about, it's your responsibility, it's our responsibility to know our own body and be our own advocate for ourselves. Thank you very much.
Unity with Pam is being brought to you by these great sponsors.
Come into Chester's Barbecue for our world-famous mouth-watering ribs, smoked fresh on our grill daily. Or try one of our barbecue pork plates with fresh sides. Chester's has delicious sandwich combos to choose from that are sure to please. We also serve tempting home-cooked favorites. And don't forget to take home your own bottle of great sauce. Chester's Barbecue, serving the best food at the best price, with 3 locations to serve you.
You love your parents, and it's hard to see them struggle to keep their independence. Magnolia Manor can give your parents the assistance they need to enjoy life. You won't have to worry if they are eating well or taking their medications properly. And they'll be in a safe, secure environment with no need to worry about cleaning house or doing yard work. Visit magnoliamanor.com to learn more. Magnolia Manor, just down the road. A community of convenience, caring, and fun.
My name is Japal. 2 years ago, I received a kidney transplant. When I was 21 years old, I started dialysis, and for 7.5 years, I was a patient receiving treatments 3 times a week for 4 hours each session. And man, it was hard. After receiving my kidney transplant, I was able to find and marry the love of my life. My kidney transplant gave me my life back.
You have the power to donate life. Be an organ, eye, and tissue donor. To find out how, go today to donatelifegeorgia.org.
Now we're going to have up 5-Star Healthcare, Beverly Robinson.
Good morning, or should I say good afternoon? It's not quite afternoon yet. I'm so glad I was able to segue after St. Francis. Ms. Gwen, I need to talk with you afterwards, hopefully. My name is Beverly Robinson, and I'm a branch manager for 5-Star Healthcare. Let's think about a 30-some-year-old young man who's been in a severe car accident. He's lost use of his arms and legs. He's completely bedbound. What about the 60-some-year-old lady who, who has dementia? She wants to remain independent. She wants to still be able to drive herself around, do the shopping, but yet her family is concerned because the dementia is starting to show signs of taking over her body. What about the 70-some-year-old man who has stage 4 lung cancer? He's living with his daughter. She's trying to take care of her home, work, do all of this by herself. That's where we come in, 5-Star Healthcare. We staff nursing aides into homes. We help to take care of your family members. We are there for you. We are located on Road Street here in Columbus. We have a main office in Atlanta. We're about to open an office in Augusta, so we're moving around. I have some pamphlets up here. If any of you are interested in finding out more about home health care, please contact me. Thank you.
Morningside Assistant Living, Melissa Rayland. I tell you, I hope y'all are getting something from all of these community leaders and providers. We need to ask ourselves, what they're saying, does this help me? Is what they're saying going to benefit me? And is what they're saying is going to change my life or help my life? Everybody here is doing something in somebody's life. It's your job. You see the programs. Contact the sponsors. They want to be used by you. So with that being said, in the hands of Melissa Rayland.
Thank you, Pam. Appreciate it. Hi, everybody. I'm Melissa Ryland of Morningside Assisted Living in Columbus, Georgia. We are a 42 apartment assisted living community. We're located next to Shaw High School on the north side of Columbus by Maple Ridge. Been knowing Pam for many years now and glad to support her today. We were built in 1999. I've been there currently about 12 years. I started as a nurse there. Now I'm the director of the community. We serve our senior citizens on a daily basis by providing them with the services they may need. Those services could be anything from just needing their meals and their medications, or they could need assistance with bathing, dressing, grooming, all of those different levels. So we provide 4 different levels of care, which means that we can age in place. You can come in and maybe you just need those meals. But then, as your diseases progress and we may get older, maybe you need help with those extra activities. And that's our plan, is to allow you to stay with us and make it your home. That's our goal. So all of our suites are apartment style. They have kitchenettes. You bring your furniture. It's home. We do have 24-hour-a-day certified nursing assistants. They're there to take care of our loved one 24 hours a day in our apartments. We have planned daily activities, delicious Southern-style meals, I'll tell you what. Yes, Lord. But we also provide things like the housekeeping. We take care of your laundry. We provide transportation to your medical appointments. It is truly worry-free living. That is our goal, is that when you come live with us, you just think about yourself and your loved ones, and it's like resort-style living. The best way to try it out is we do have respite care, which respite care means if you're providing care for someone in your home and you need to take a break, or maybe you want to go on vacation and mom or dad live with you, you give us a call. We can set up a daily rate. It's about $100 a day. That's less than a good hotel, and we're providing care for them. So when we have availability, your loved one could stay with us while you get a break, because we all will need that. You know, we don't want to be, stressed out when caring for mom or dad. We want to give them our 100%. So, we would like to invite you to come by and see us at Morningside. We have planned activities, so come by, play some dominoes, play some bingo, and really see what we're about. The other thing, if you do choose Morningside to move in permanently, we're pet friendly, which means that you don't have to leave Fido or Fifi. They're your loved one too. So you get to bring that cat or dog with you. So that's your loved one. Mom and dad may love that little dog. I know my father-in-law truly loves his dogs.
Thank you for watching Unity with Pam. If you would like to be a sponsor, please contact us or visit unitywithpam.org. Production for Unity with Pam is provided by At Motion Media Incorporated. Always show love in the community.